Good morning, everyone. Today I'm going to talk about telemedicine. So, when my dad was diagnosed with stage 2 colon cancer, he went under emergency surgery. Fortunately, the tumor was removed successfully. But in between March and November, he had face-to-face visits mainly asking how he was feeling. After the surgery, the medical team decided he did not need the chemotherapy. So every 3 months, he has routine visits at the hospital for blood work, physical assessments, and after 9 months of remission, he was due for his routine checkup, right? His condition progressed to stage 4 and the cancer spread into his liver. So you wonder what does this have to do with my topic today, right? So first, we need to look at why is it important to have telemedicine for patients and practices. After knowing the importance of telemedicine, we can define what is telemedicine, and lastly, we will cover if the implementation of telemedicine improves patient care. So from various different research articles that I read, these are the top common benefits that the patient had. So telemedicine saves time and money. Traveling requires money for gas and possible time off from work. So in comparison to being admitted to the emergency room or walk-in clinics, telemedicine is so much cheaper. It also cuts the dreaded time waiting at the hospital, and telemedicine also caters to the needs of the patients from any place at any given time. So the following reasons resonated with my dad's situation as the time when he was diagnosed. There were times when he wasn't feeling too well in the middle of the night or even at 3 a.m. So the drive is about an hour away since we live in a rural area of Atchison County and VA hospital situated in Leavenworth. If telemedicine was part of his care, I would have been less anxious and less worried if his condition warranted the need at the emergency room. So if telemedicine was available, and if we were told that he did not need to be sent in, we would not have to travel during winter in the middle of the night and pay so much at the emergency room. So this would also prevent anyone who was immunocompromised to catch any hospital-acquired infections as well. So from my research paper, the subject focus were patients with chronic conditions who live in rural settings. Telemedicine is also important for these practices. Practices can reach underserved populations such as the elderly, chronically ill patients, and veterans who do not have access to immediate transportation. The practices can also save money by using telemedicine by decreasing the likelihood of no-shows. Along with saving money, it increases the pool of potential patients, which leads to more revenue. And lastly, telemedicine also delivers more preventative care and offers more affordable care services. What I found very interesting with the journal articles was about the patient surveys regarding the use of telemedicine. The numbers vary depending on which article, but overall it had positive numbers that favor the use of telemedicine. It also improved the patient relationship with the medical team. So what is telemedicine? Basically, telemedicine refers to the practice of using technology to communicate when evaluating, diagnosing, and caring for patients at a distance. So examples of this type of communication are video consultations with a specialist or your physician. It's a similar function like Skype or FaceTime. Email messaging has been around for a while and it also is a form of telemedicine services. So I read a lot of things about interchanging telemedicine and telehealth. So telemedicine and telehealth are often mixed together. So to simplify, telehealth refers to non-clinical activities such as the medical education, administrative meetings, and provider training. So after implementing telemedicine as part of the patient's care plan, the results were positive and significant, especially for patients that requires longer treatments due to chronic conditions such as diabetes and heart disease. The next one ties back again on patients being diagnosed and treated earlier, often usually have better outcomes and less costly treatments. The next point is very important as we know that there is a shortage of healthcare providers, no matter which setting it is, but more so in rural settings. Telemedicine aids in that shortage and misdistribution of healthcare providers. So according to patient surveys, patients feel more empowered, more knowledgeable, and more encouraged in taking up an active role in the healthcare using telehealth. So back to my father's story. Along with an excellent medical care team, my dad is still with us 2 years later and has been on remission. There's the first picture when he was back in 2016, and then this during November. So during his chemotherapy period, I asked about any video meetings that we can use at the comfort of our home. So what it did was it saved us time, money, and it also decreased the likelihood of my dad from catching other infections every time he visits for a non-physical assessment at the hospital. So just like me, you may have known someone who is struggling with this technology that we're having since it's so fast. So in my case, it's my parents. I think as a future healthcare provider, a daughter, a son, or even a neighbor, we need to assist these individuals so they can better understand how to navigate their patient portal, for instance, or assisting them in setting a webcam for video conference. Even helping download a health app into their smartphone will make a difference into their lives, and this can help them play an active role in their health care.